Physiotherapy and Wellness right here in Collierville, Tennessee. Hopefully I'm coming through to you live all right. I'm coming from a different venue today. Trying instead of my coffee talk. I'm a little late and coming to you with kombucha talk, maybe? I don't know. I was going to try it, probiotics, with all the scare that's going around. If you are coming on, please tell me if you can see and hear me all right. Just wondering if I'm coming through loud and clear. So if you can give me a thumbs up or you can see and hear me, would be great. All right, so we're gonna talk about getting to the root cause of your pain. This is something I'm pretty passionate about, especially this type of treatment. I've been doing it for quite a long time. Again, hopefully I'm coming through loud and clear for y'all. I don't know why I have my earphones in, because I can't hear you anyway, but hopefully my microphone's working and you can see and hear me all right. So if you're coming on, again, Dr. Trevor from Peak Potential Physiotherapy and Wellness. This is something I'm pretty passionate about, is to get to the root cause of your pain. And this is a type of treatment we can do in order to get you there. So again, if you're coming on, let me know you can see and hear me all right, and that I am coming through loud and clear. So to get to the root cause of your pain, I'll try not to go off on too many tangents on this, but this is a treatment that's been around for a long time, and we'll get into a little bit of that, but I've been doing it since I got out of school almost over 15 years ago. So it is something that is really safe, it is effective, it is research-based, and it works. You know, how many of those things can you actually tick off on a conservative treatment, right? And that it actually does work. So again, hope everyone can hear me. I'm using some different headphones today. I don't know why my other ones wouldn't work, but here you go. So how to get to the root cause of your problem. So when you go to the doctor, you get a prescription, and that's usually chasing symptoms. Although maybe very effective in the short term, you never quite resolve the root cause of your pain or your movement problem. So this is what we see all the time here, is that people come and say they've tried all the good stuff, they've tried all the good treatments, and they're still having problems. But they were only getting their symptoms treated, not the cause of their treatment, okay, or a cause of their pain. So finding the source of the pain and dysfunction is our goal. So using something non-invasive like the Astym instruments, we can both locate and treat this pain source as well as the root cause. So we have seen Astym to help countless patients restore movement, relieve pain, and get back to their lives and doing the things they love, like running or playing with their kids or walking or anything like that. I was talking to a podiatrist just this morning about someone who wanted to cut their feet off because their pain was so bad, and this treatment got them back to living their life and living their best life. So it's worked on many, many patients. And when other approaches or symptom chasing things have failed, so people usually ask, what the heck is Astym? What does it stand for? What is all that? And it doesn't stand for anything. It stands for a stimulation. So again, if you are jumping on, please let me know that you can see and hear me all right, or else I'll have to jump on and cancel this and do it another way. But what is Astym? So Astym is a treatment that regenerates and rebuilds soft tissue, okay? This includes muscles, tendons, ligaments, anything that your body can get damaged soft tissue-wise. So damage to these tissues is often the cause of chronic pain and movement restrictions. Also, fascia is part of this as well. So in addition, Astym addresses scar tissue as a frequent culprit to the movement limitations and pain and symptoms. Astym safely and efficiently stimulates scar tissue to be resorbed by the body This means that you are often getting the root cause of the problems, which is the body not healing itself correctly and allowing the body to safely and naturally repair itself and lay down new tissue that then you can guide that healing process. So the best part for this as clinicians is that is backed by results. It's backed by research with over a 92% success rating. Yes, that's right. I'll have to put that. Let me put that in there. So 92% success rating, and that's overall, okay? Over all problems. It's pretty amazing, you know? So if you are wondering if this can help you, please raise your hand, put it in the comments, let me know if you have questions. We can get to that. But what can Astym treat? And again, I might be letting the cat out of the bag here, but it really can treat anything. And I don't know why more clinicians and providers aren't trained in this. And that's why I'm trying to get the word out, especially now. We're bringing it, and the other practitioners, the other providers at our location are getting certified in it. But Astym can successfully treat a long list of injuries and anything. So I'll list off a few, but like golfer's elbow, carpal tunnel, tennis elbow, Achilles tendon problems, post-surgical scarring, even mastectomy scarring and pain. It's been very good for that. I've seen that firsthand when treating a patient. Joint stiffness, muscle strain, low back pain, pain and stiffness from arthritis. All of these things are within the realm of Astym, and they help. They help, guys. I'm telling y'all. But there's also, what are the benefits of Astym? So we have seen numerous benefits of Astym compared to other treatment techniques that we use. And in fact, it is one of the most research and proven treatments available. There's all those other things. I'm not going to get into a lot of, the other tool-assisted treatments, but there's other names out there, Graston, Astym, just ASTR or IASTMs. But those don't have the backing of all this research. And so one benefit is the treatment works quickly. Patients generally see some progress in the first 3 visits, but a full course of treatment often lasts 8 to 10 visits is the general regimen or the general length of time. And that's usually twice a week. So you're talking 4 to 5 weeks. So it's a shortened amount of time. You're not going to be there for months. It's going to be 4 or 5 weeks. And it will help. You will feel a difference. You'll also usually feel a difference between treatment sessions, because that's when the body's actually laying down new tissue. It's laying down that new collagen fiber that's going to get stress put on it, and the body will adapt to that. So that comes to number 2 of some of the benefits, is that you get to remain active. We're not going to shut you down on this. We actually encourage the people we treat to continue normal activities. Now, we do say we let pain be your guide, because if the body senses pain, it's going to start laying down scar tissue and thinking like that. But there's no time off needed to recover. So this allows the tissue to recover, the tissue recovery to occur in a way that supports your usual activities. That which is stressed, the body adapts to. So the body adapts to the stress that it's put under. So we want to put that stress through it correctly, right? That's why I was saying we stimulate it and then we guide that healing process, okay? Number 3, it fixes the source of the problem. This is also, we treat the entire kinetic chain. So with Astym, we're not just relieving symptoms. We're not just giving you medication or a dose pack or something like that and just calming down inflammation. So we're getting to the source, not just the source of your pain, but to the root cause of it. So this allows your body to rebuild healthy tissue. So you get to heal properly and you get to heal completely. Okay, so this is important in preventing future injuries. And that's why we treat the entire thing. We're not just going to treat your foot, we're going to treat the whole leg. And we're going to make sure that you're strong in your hip and in your back to prevent those things from bothering you. So we want to get to the root cause, to the source, not only the source, but to the root cause. Okay, so, and then just from a patient's perspective, I told you we had the one person who he wanted to cut his feet off, y'all. And I just talked to his podiatrist, and he's still doing great. So Sylvia's another one. So previously she had received cortisone shots for hip bursitis. However, the pain still didn't go away. So she was told, so I'll quote here, I was told I would have to have a hip replacement. Instead, with Astym treatment, I've gone from being paralyzed by steps to walking for days at a time, gardening and going to the grocery store. I have my life back, and that's great. End quote. Thank you, Sylvia. So, in summary, Astym works. It's research-based, it's case study-based, it works. However, only clinics with a certified Astym therapist can provide this treatment, or else they're just trying to bruise you and just, they're using tools. So this is a research-based, instrument-based, non-invasive, effective, and effective treatment that will get you back to doing the things you love to do. So we undergo intensive training in this that gives you the results you expect with Astym treatment. So if you're ready to speak to one of the certified providers to see if this is a solution for you, you can click on the button in the article there that I put down, and you can request a call, and we can see if this treatment is right for you. But this stuff works, guys. I've used it from someone's head to someone's toe, and it works. Anytime you have a soft tissue injury, this stuff works. Okay, so I hope this gives you a little bit of insight into the Astym treatment. We're trying to push it out there. This is something that we uniquely and are uniquely providing our community. We're the only Astym certified providers in a 150 mile an hour radius. 150 mile radius, not mile an hour. I just drove, so I was thinking miles per hour. But I hope this gives you some more information of what the heck Astym is, and we definitely need to get to the root cause of problems, which is usually the body's inability to heal itself correctly. Okay, so I hope this brings you some value. Please click on the article, leave your questions below, and we'll get to those as quickly as we can. Again, it is Dr. Trevor from Peak Potential Physiotherapy and Wellness. You can check out our podcast. I just had an in-depth interview about Astym treatment. It was actually picked up by Astym. I don't know how they found out about it, but they figured it out. And they posted on their site as well. So please check it out. If you have questions, request a call, put it in the comments below, and we will get to those as quickly as we see them come through. So again, it's Dr. Trevor from Peak Potential Physiotherapy and Wellness. So no coffee talk today, but we have kombucha talk today. So probably should cover up the name, so I'm not influenced by any names, right? So everyone have a great rest of your week, and I hope to hear from y'all soon. Please don't hesitate if you have any questions on what or any other things that you might want us to speak about. I'm more than happy to get to those whenever I can. All right, thanks again.